Doctor Talk, brought to you by Bangkok Hospital.
How important is health to you? Rising early to do some morning yoga or Tai Chi is a healthy way to start the day. Breathing in and out to bring fresh air into your lungs.
เมื่อก่อนนี้ทำงานก็ไม่ชอบหาหมอ
มาหาคุณหมอตอนที่เบาหวานขึ้นตามองไม่เห็นเป็น15นาทีคือนั่งทำงานอยู่เนี่ยหัวฟาดกับโต๊ะไม่รู้สึกตัวเลย
เมื่อตอนอายุ60ไปเจาะเลือดเป็นครั้งแรกถึงได้รู้ว่ามีความดัน
โรคเบาหวานเธอก็อ้วนแล้วก็ลมสูง
Living in a metropolis makes it a challenge for us to maintain good health. Pollution, traffic, and crowded spaces are some of the obstacles we face daily. Too often we ignore these problems until we realize it's too late. So, how can we deal with this before it takes a toll on our health? Doctor's Talk is here to help so that you can take charge of your life.
Hi, welcome to Doctor Talk. I'm Dr. Jan, and each week on the show we tackle different health issues and find out the best answer for you. And this week I have a special guest with me. Hello Art, how are you?
I'm good, Dr. Jan. How are you?
I'm very good, thank you.
I'm very excited to be here on Dr. Talk. That I'm here today because I have so many questions. One of the questions I have is about medical checkups.
Yes.
Because what I realize is that as you get older, the medical checkups tend to change.
Yes,
It becomes more detailed.
Yes. So before we reach the age about 60 to 65, the checkup is usually about general checkup to check whether we have diseases like general things like diabetes, high cholesterol. But once we reach the age of 60 years old, we are at the increased risk of having a lot more complicated problems.
I'm very concerned, and I'm sure there's a lot of people out there who are concerned about their parents, about their grandparents, where should they go, what advice should they get. So some of what I'm concerned about is, as my parents are older, it's like, who do I send them off to see? What type of specialist? Because my parents tend to be very comfortable with just one doctor, but I'm not sure at their age if it works for them.
I take her to the doctors and help explain what the doctor is saying and help her remember things because she's getting old and she can't remember stuff.
It's one of the best things I can do for my mom who's a breast cancer survivor. She had cancer a couple years back, is to make sure that she's happy and not stressed out. One of the biggest things for cancer survivors is to make sure that they're constantly happy, and that limits the chance of a reoccurrence of the tumor later on within the next decade or so.
And the best way that I like to help take care of them is to spend time with them.
Father doesn't really pay attention to his health, and neither does my mother. And so I really try to motivate them in this topic.
I have an answer for you because at Bangkok Hospital we actually have a new clinic called a longevity clinic. It's a very nice way of calling a clinic for an elderly people. At that clinic, we actually have a geriatric specialist. It's not just one specialist, but the whole team. They have specially trained to look after old people. They actually have to form a team because we know that for old people, they don't have just diabetes, hypertension, heart disease, stroke. they have other problems as well. They have problems like, when they can't read things properly, they trip overs, or they might have problems about controlling their urine, they have problems going to toilet, or they might not want to eat. So it's more like a functional problems rather than a medical problems.
So the specialist would specialize in really catering to the needs of an elder.
Yes, so the specialist is trained to talk to old people.
Oh, really? And then along with that, you're mentioning that the specialist has a whole team.
Yes.
That helps supports him or her. That's very interesting. Usually when you see a doctor, you see the individual doctors.
Yes.
But then you don't combine them together. So you're not exactly sure what you're taking will kind of clash with something else that you're taking from another doctor. So you're saying that a geriatric specialist is a person who will basically combine everything together and see if it's working, if it's clashing or not. In a nutshell, I mean, who's in the team?
Okay, we have a doctor, of course, a nurse, dietitian, a pharmacist, physiotherapist, and they could call whoever the patient needs into the team as well.
Oh wow! Now the term geriatric is very new. It's a new term for me. Is this whole specialist? Is it fairly new in the medical world?
Well, it's been around in other countries for around 20 years. But in Thailand, it's very new because here at Bangkok Hospital, we set this up last year because we actually realized that old people, they have different needs other than just medical side of things, but more other assessment to basically increase their function, or they can live independent.
So is there like an age range?
Yes. Here we recommend people who's actually at 60 years old and above to have this assessment with geriatric team. So you wouldn't be I just don't fit into it just yet. No, not yet.
Maybe
not yet.
in
20
years, 20 some years. But you know what? Actually, I have a very close friend of mine. She's a professor that I went to school with, and she's just reached 60.
Okay,
so
perfect age.
And I just met her recently. Her name is Mrs. Jum. Okay. So would it be okay if I send her to a geriatric specialist
definitely,
here?
Definitely.
Okay.
Yeah, so we can learn more about the teams and how everything works as well.
That sounds great.